here today with Wendy Thompson, CEO of Friend Health. Welcome to the show.
Oh, thank you. Thank you for having me.
Thank you so much for being here. Tell us a little bit about yourself.
Sure. I'm a native South Sider of Chicago. While I spent most of my early career in finance at some point, I had a greater calling for public service, and so spent about 10 years working with Chicago Public Schools. And after working with Chicago Public Schools and taking a little respite, I learned about Friend Health. And Friend Health being a community health center, what I realized is I was working with the same population. And for me, what drew me to education is that education is one of the most transformational opportunities for any individual. And what I very quickly learned is that healthcare is equally as important. So for me, it was what drew me to this work was the mission to help people live their best lives.
When and why was Friend Health founded?
Sure. Friend Health originated as Friend Family Health Center. So for Southsiders, that may be a name that is familiar with many. Began in 1997, and the focus at that time was pregnant women and infants. That evolved to a focus on women, OB-GYN, so women's health, to children, and now we're full service. So we provide comprehensive medical, adult medicine, which is family and internal medicine, pediatrics for children and adolescent, OB-GYN, focusing on women's health. And additionally, we have behavioral health, mental health, and addiction, as well as dental services, a host of enabling services. So we're here to try and meet the needs of the community.
And you kind of talked about how you became interested in healthcare and health administration. Can you kind of talk a little bit more about it?
Sure. So I am a Chicago native. Went to college here at the University of Chicago, and it's quite ironic that I spent so much time in the Hyde Park area, and that was the flagship for many years of Friend Health. And so we recently, in 2022, moved to the Woodlawn community. We're at 63rd and Cottage Grove is our largest site, and that is one of 6 plus 2 mobile units across the south side. We serve about 40,000, and for us, not only did it give us more optimal facilities, we were on the University of Chicago campus in what was formerly a school with cinder blocks, and so as we look to optimize technology, ensure that we were offering the community the best that we could with respect to equipment and facility setup, we determined that it was best for us to expand. So we're now in a 40,000 square foot facility at 63rd and Cottage Grove, and we've been able to put the full level of services available. We have plans, hopefully within the next year and a half, we'll have a phase 2 at 63rd and Evans, 1 block over, where we'll have dedicated same-day service, immediate care, dental, and behavioral health. One thing I want to mention is that in 2017, we merged with HRDI, which has also been in the community for more than 50 years, actually. And between the two organizations, from a behavioral health perspective, we provide the complete continuum. So everything from 24/7 crisis support to residential supportive housing for individuals with mental health challenges, as well as those addressing addiction.
Why is it important to expand access to quality health care to communities on the south and west side
So healthcare is a right, and far too often it feels like it's a privilege. One of the things that we emphasized in both our 63rd and Cottage Grove location, as well as our newest facility in back of the yards at 47th and Ashland, the old gold black buildings, for those of you who remember. We feel as though the community deserves facilities and services that they would get at University of Chicago, Northwestern, Rush. They deserve compassionate care. They deserve support in navigating what is an incredibly complex system, the healthcare system, for anyone. So, part and parcel to the visit with a provider, we have a host of supports: care coordination. We provide community health workers that oftentimes are best able to translate all of the information. And we really want to switch the narrative from going to the doctor because you're sick to going to the doctor, to your primary care provider to stay healthy.
What are some innovations in community healthcare delivery that people might not be aware of, but they should definitely have on their radar?
So healthcare has evolved, and technology has played a significant role in that evolution. So we are actually in the process of moving our electronic health record system to Epic. For those of you who have likely been to a hospital or several of the major health systems, it is the EHR that's connected to MyChart. We're excited about that for the community because what MyChart means is you have your medical records there, you have your prescriptions there, you have a portal by which you can easily schedule appointments, ask a question, have a telehealth visit, get a prescription refilled. And so we're excited about being able to bring that tool to the community. Additionally, COVID, we learned a lot. And one thing that I think is the biggest transformation for us is we are focused on meeting the community where they are and when they want to be seen. And so a significant portion of our services are now same-day access, walk-in, because we understand first and foremost that people have choices, but we also want to ensure that access is never a limiting factor to someone getting the support that they need. Telehealth has been tremendous. We have a number of individuals who, whether it be transportation, whether it's childcare, or physical condition, our pregnant moms, our seniors, to access and care, telehealth now opens up a whole new avenue to connect to those resources. Care coordination has become an essential component. You've probably heard the statistic that 15% of the factors that impact your health outcome happen in the exam room, and the other 85%, social determinants of health, happen outside. And that is really where our care coordination team comes in. They educate, they assist individuals with scheduling, they assist with insurance enrollment, they work with patients regarding health assessments, and put individuals on a path for maintaining their health, for intervening and changing the tide or the trajectory of their health outcome. So that's been significant. I think I mentioned community health workers. We're really excited and proud of the work that we've done. We're just completing a 3-year project whereby we've worked with 100 individuals from the community, several of which are our patients. So they're coming from Woodlawn, Washington Park, Gage Park, back of the Yards, West Elsden. And these are often individuals who either have not worked outside of the home, or perhaps they have and haven't had the success that they would like to have. And we have supported them both through emotional, moral support, but also financially in completing the City College's Malcolm X, specifically their community health worker program. So they actually become certified as community health workers. That includes tuition and all of the materials. Additionally, they were able to complete their clinical hours in our health center, and for those who successfully completed, they were afforded the opportunity to have a 1-year paid apprenticeship. And so all of those individuals were able to become full-time employees. Some of them are with us, and some of them are at other organizations, and most have multiple opportunities afforded. And one of the first community health workers is now about to become a manager. And so it just, it's investing in the community that's directly related to healthcare outcomes. We know it's the tie with mental health. Mental health plays such a role in managing chronic conditions. We know depression is highly related to diabetes, stress, related to ulcers and a lot of digestive issues. And ultimately being able to support yourself and support your family is just fundamentally critical to living your best life, and that's what we aim to do.
Where can people go to find out more about Friend Health?
So you can always reach out to us at friendhealth.org. You can sign up for our newsletter, and you can also follow us on social media. You can reach out to us at 312-682-6110, and the individuals, our patient services team, will help to find the location that works best for you, to better understand what your needs are. You may encounter us out in the community where we are at a number of health fairs, or our mobile unit that is providing medical or dental services.
Before we wrap up, is there anything else you'd like our audience to know?
I think I'm just going to circle back to the point that healthcare is a right, and we take that very seriously. It's core to our mission, and so we spend a lot of time focused on integrated care, with the intent that regardless of what you come to us for, a school physical, a stomach ache, a headache, we're going to address that issue, but we're going to ensure that we empower you to take charge of your health. And so with that, every individual will have access to not only medical but dental, behavioral health across both Friend Health and HRDI, because we're part of the community, and we want the community to live their best life.
Great. Well, thank you so much.
Thank you for having me.